If your legs suddenly feel weaker than they used to, even though you haven't changed your routine, this is not normal aging. It could be the earliest warning of a deficiency that accelerates muscle loss in seniors, one that most people never check, one that silently pushes you toward frailty, falls, and mobility decline. Geriatric specialists see this problem every day. Seniors come in saying their knees buckle, their legs shake, or their steps feel unstable. They blame arthritis, age, or being out of shape. But something deeper is happening, something that steals muscle from the inside. And before we reveal the deficiency, you must understand one thing first. Muscle loss after 60 is not random. The body sends multiple warning signals. Signals many seniors ignore. Signals that all point to the same frightening root cause. Let's start with this. Harvard Health reports that muscle loss accelerates rapidly after age 60. You lose up to 3 to 5% of your muscle mass every decade. But when this deficiency is present, the speed of muscle loss doubles. Your legs deteriorate faster. Balance collapses. Strength drops sharply. This deficiency affects the nerves, the muscles, and the energy systems that power your legs. Without it, the brain struggles to send strong signals to your lower body. Your muscles try to respond, but they cannot. The result is sudden weakness, sudden fatigue, and eventually loss of independence. Before I name the deficiency, let's check the symptoms that reveal it early, because many seniors have it for years without knowing. Symptom 1. You stand up from a chair and your legs feel shaky, not from pain, from weakness. Symptom 2. You walk for a short distance and your thighs feel heavy, like someone slowly tied weights around them. Symptom 3. You climb stairs slower than before. Your knees feel fine, but your muscles lack power. Symptom 4. Your balance feels off, especially when turning or stepping sideways. Symptom 5. You lose energy quickly, even when doing simple things like cooking, walking to the bathroom, or getting out of bed. If even one of these symptoms describes you, this deficiency may already be affecting your muscles. But if 2 or more match, the risk becomes very high. Now, let's reveal the deficiency. The one that accelerates muscle loss, weakens the legs, and destroys mobility in seniors. The deficiency is vitamin D deficiency. Most seniors think vitamin D only supports bone health, but modern research shows its role is much bigger. Vitamin D is a muscle-activating hormone. It tells your muscles how to contract, how to fire, how to stay strong. Without enough vitamin D, your muscles lose their ability to generate force. Your legs weaken. Your nerves slow down. Your reaction time drops. And your risk of falling increases dramatically. Here's the part that shocks most seniors. NIH studies show that over 60% of American adults over 60 have low vitamin D levels. Many have dangerously low levels without knowing. And when vitamin D drops too far, the brain-muscle connection weakens so badly that even simple daily movements become risky. Your leg weakness may not be age. It may be a signaling failure. Harvard Health confirms that vitamin D deficiency leads to accelerated sarcopenia. Sarcopenia is age-related muscle wasting. Once it begins, it moves fast. It shrinks your thigh muscles first, then your hips, then your calves. Exactly where most seniors notice weakness. Why does vitamin D deficiency hit the legs first? Because leg muscles are large, dense, and require strong nerve signals. When vitamin D is low, nerve signaling weakens. Large muscles become the first victims. But here is the frightening part. Vitamin D deficiency does not only weaken your legs, it also increases your risk of fractures, falls, and even premature mortality. Mayo Clinic warns that leg weakness from vitamin D deficiency raises fall risk by up to 49%. Falls are the #1 cause of injury-related death in seniors, all because of one deficiency. But before we jump into solutions, you must understand why seniors lose vitamin D faster after 60. Reason 1. Skin makes less vitamin D as you age. By age 70, the skin produces only 1/4 of the vitamin D it did at age 20. Reason 2. Kidneys convert less vitamin D into its active form. This makes deficiency worse even if you get enough sunlight. Reason 3. Seniors spend less time outdoors, reducing natural vitamin D production. Reason 4. Digestive issues reduce vitamin D absorption. This includes low stomach acid, which is common in older adults. Reason 5. Medication interference. Common drugs like steroids, anticonvulsants, and certain cholesterol medicines reduce vitamin D levels. All these factors create the perfect storm. Sudden leg weakness becomes the first visible clue. Now, let's get into the effects of vitamin D deficiency that seniors rarely hear about, effects directly tied to leg strength. Effect 1. Muscle fibers shrink, especially the fast twitch fibers needed for balance and stability. This creates instability on uneven ground, slippery floors, and stairs. Effect 2. Muscle recovery slows dramatically. Small stresses like standing too long or taking longer walks take hours to recover from. Effect 3. Nerve conduction slows. This means your brain sends movement signals slower than before. Your feet react slower. Your steps become shorter. Your stability drops. Effect 4. Inflammation rises. Low vitamin D increases chronic inflammation, which damages muscle tissue over time. Effect 5. Calcium absorption decreases. Now the bones weaken too, adding another layer of danger. You see the pattern. 1 deficiency. Multiple dangerous consequences. So, how do you know if your leg weakness is caused by vitamin D deficiency? Here are early clues. Morning leg stiffness that disappears after a few minutes. Unusual tiredness after short walks. Trouble lifting your leg into a car or onto a stair. Leg cramps at night. Difficulty rising from low chairs. A feeling of unsteadiness while showering or turning around quickly. If these sound familiar, you must pay attention. Next, the crucial question. How much vitamin D does a senior actually need? Mayo Clinic recommends levels between 30 and 50 ml for muscle health. Many seniors are sitting below 20 without knowing. The easiest way to check is a 25-hydroxy vitamin D blood test. It is simple but often not included in routine tests. Ask for it specifically. Now let's talk about food. Food can help, but here is the truth. Most foods contain too little vitamin D to fix a deficiency. For example, salmon gives around 400 to 600 IU. Egg yolk gives 40 IU. Fortified milk gives around 100 IU. If a senior is deficient, these foods help maintain levels but do not correct severe deficiency. Next question. What about sunlight? Sunlight helps, but after 60, the skin loses the ability to convert sunlight to vitamin D efficiently. Sunlight becomes supportive, not sufficient. That brings us to supplementation. But supplementation is not the full answer either. You must know the right form. Vitamin D3 is the form your body absorbs best. Vitamin D2 is weaker and less effective. But here is the part nobody talks about. Vitamin D3 needs magnesium to activate. Without magnesium, vitamin D does nothing for your muscles. This is why some seniors take vitamin D supplements but feel no improvement. Their magnesium is too low. Magnesium deficiency is extremely common in older adults because of low intake, digestive issues, and medications. So, vitamin D alone is not enough. You need vitamin D3, magnesium, and vitamin K2 for bone and vascular health. This trio forms the foundation for strong legs. Now, let's shift to the topic seniors care about the most. How fast can this deficiency be reversed? And when do you feel stronger? Studies show that once vitamin D levels rise into the healthy range, seniors begin gaining muscle strength within 3 to 8 weeks. Balance improves. Walking becomes easier. Stairs feel less stressful. Legs feel more stable. But here is the real win. When vitamin D is restored, seniors also reverse sarcopenia progression. The legs regain power, the thighs rebuild, the hips get stronger. Your independence returns. Let's move now to the practical plan backed by Mayo Clinic and NIH. These are the daily steps that help restore leg strength faster. Step 1. Check your vitamin D level. This is the most important step. Step 2. If deficient, take vitamin D3 in the dose recommended by your doctor. Never exceed safe limits. Step 3. Add magnesium daily. Magnesium glycinate or citrate works best for seniors. Step 4. Add vitamin K2 MK7. This directs calcium into bones, not arteries. Step 5. Include vitamin D-rich foods, salmon, sardines, egg yolks, fortified dairy, mushrooms exposed to sunlight. Step 6. Walk daily for at least 10 minutes. Movement increases vitamin D receptor sensitivity in muscles. Step 7. Perform simple leg activation exercises. No heavy workouts needed. Just standing leg lifts, chair rises, and calf raises. Within weeks, seniors feel the difference. Now, here is something even more important. If vitamin D deficiency is ignored, the consequences go far beyond leg weakness. Low vitamin D increases risk of falls, risk of hip fractures, risk of heart disease, risk of diabetes, risk of cognitive decline, risk of immune weakness, risk of depression, risk of early death. This is why geriatricians insist seniors take vitamin D deficiency seriously. Before we close, let's recap the danger signs of deficiency. Your legs feel heavy. Your thighs feel weak. Your steps feel unstable. Your balance feels worse. Your energy drops quickly. You struggle to rise from chairs. You walk slower than before. You lose confidence while moving. If these signs are happening to you, do not ignore them. Do not wait for the symptoms to worsen. Every month of low vitamin D accelerates muscle loss. Vitamin D deficiency steals strength silently, but correcting it restores strength rapidly. One deficiency. One solution. One chance to reclaim mobility and independence.